I am from Hungary, and we have just started a joint initiative together with the ESDR to build up a stronger collaboration between Eastern European or Central European countries in terms of dermatological research. And the initiative, or with this initiative, we are trying to invite researchers from Eastern Central Europe to our annual meeting of the Hungarian Dermatological Society to present their scientific achievements. And their travel and accommodations costs are jointly provided by the ESDR and the Hungarian Dermatological Society. And with this initiative, we hope that we can build stronger relationships. We can help each other to achieve goals. Perhaps we can even find mutual areas of research, so we can collaborate. We can build up databases, for example, because people in this region probably have different genetic background than people living in Western Europe. So I think there's many aspects of it, and we are just in the beginning of this initiative, but we hope that it's going to also build new areas where we can collaborate. First, we have to probably clarify what translational research is. So it's a research where the information goes first from the bedside, then we translate it to basic lab work, and then the information goes back to the bedside. So basically we use the information that we gather in the lab to help people around the bedside. So basically this is what translational means. We translate the basic research results to patient care. And of course, usually the main importance of science is, I think, to get something in the end as a product or something that we can use in real life. Of course, basic science is about discovering life itself, or discovering just how our universe is working. But translational science means that we are using these pieces of information to basically help patients at the bedside as well. So nowadays we have the opportunity to basically look into personal information that comes from individuals. Medicine traditionally has been something that was based on information gathered from a lot of people, and then using that knowledge to help the individuals. However, this is usually, or this is working usually, but for some instances it's not working because we are not the same. And now what individualized healthcare means that we try to understand not just the things that we are in common, but also the things that we differ from each other. And then we can develop a plan for each individual to help that individual much better than just giving an average plan. And now everybody's wearing these personalized gadgets like smartwatches or phones, which measure our activity every day. So we measure our pulses, we measure our activities, it knows where we are, whether we are under stress or not. So we are collecting information that can be put together with our individualized information. And also we know now much more about our, for example, our individual genes. So many of us can already have our genes sequenced. And from this information, together with other information, we can put together again something that is much more individualized than just a general healthcare advice. Requires a completely different mindset as well, because our approach is in the past or even in the present has been completely different. We are if you come to my office, I usually have a really small piece of information about you. I only see maybe your medical records, which I usually don't have time to go through in detail. I see maybe some background about your family, medical history, but you probably have much more data, which could be analyzed, but it requires a different system to be analyzed. And probably with artificial intelligence, it could be done, and this can help making decisions much better than previously. But of course, it will require a completely different setup in the healthcare system, and this requires new tools. Some of the tools are already there, we have it, but probably we have to cooperate with information technology specialists much better for the future to actually use this data. It's not easy. It's hard to tell future trends. There's so many different things you can think about. Obviously, this kind of information technology approach will be much more part of our daily life. So we will probably use it. Also, there's a revolution going on with pharma. So we can now design much better drugs, and perhaps these two fields will merge in the future, and we will be able to design really individualized treatments if someone is having a disease. Of course, the question is whether we want to really treat the patients, or we want to predict or prevent the disorders or the diseases before they develop. That would be the ideal situation. So I'm not curing a patient whenever the patient is having a disease, but I can predict that individual is likely to develop that disease, and then advise how to avoid the development of that disease. Well, that's a very interesting concept that the ESDR has started to really work on this big data that we are now gathering. There's much more information out there about skin diseases, about skin health that we are using, and we could actually make sense of. So the SSF is trying to give help in order to go into this direction, and I think it's a really good initiative, and we will probably make huge steps together with the help of the SSF. And also, this is the first time when pharma and basic research is working with such a large initiative.
Next.
Yep, I think the most important thing is that now we have many of the tools that is required to work on such projects. 10 years ago, information technology, data management, data collection actually, and also basic scientific tools were not able to provide the data or to make sense of the data. So this is I think why we are starting to work now on this, because now we have all the tools to put it together. The different areas of science can come together and give us a much better picture. So P4 means that we've talked a little bit about it earlier, that it's the general idea of medicine is to treat patients whenever they have something that is not healthy, so they have a disease. And P4 medicine means that it's actually a preventive type of medicine. It's proactive, so it looks at the conditions before they develop. It looks into it's kind of it's similar to the ancient Chinese way of approach. In ancient China, as far as I know, the physicians were not paid whenever they went to the doctor for a cure, but they were paid when the patients were healthy. Of course, the doctor was very likely to keep the healthy state of that person, and they were not paid when the person got really actually sick or went into being a patient. So this is preventive, proactive, participative. So the patient must also participate, and we are participating with our smartwatches. For example, we are providing data to our healthcare provider, so it must be participative as well from the patient. So it's a different way of looking at health and disease.